Hey everyone, welcome back to the channel. If you're someone who's ever had a urinary tract infection or UTI, you know just how frustrating and painful they can be. For many women, UTIs are a repeat problem, and it's easy to feel fed up or even embarrassed. If you ever had more than one UTI, you know the struggle. The constant burning, pain, frequent urge to go, and the disruption to your everyday life can be exhausting. Having repeat UTIs can lead to sleep issues, missed days at school or work, and over time make you feel anxious or stressed, always worried about when the next infection is going to hit. We're here today to help break that cycle. Today we're diving into why UTIs happen, why women are especially prone to them, and most importantly, the best ways to prevent them in everyday life. Let's start with a simple question. Why do women get more UTIs than men? The answer is based on anatomy. Your urethra is the tube that carries urine from your bladder out of your body. Men's urethra travels through their penis, so hopefully it's 6 to 9 inches in length. For women, the urethra is much shorter, about 1 to 2 inches in length. That short distance makes it much easier for bacteria to get to your bladder and cause infections. Plus, the opening of a woman's urethra is a lot closer to the anus, where bacteria like E. coli live. That's why it's the most common bacteria responsible for UTIs. So let's talk about prevention. There are many areas in your life where you can minimize the risk, and they are all connected. Good bathroom habits are a must. Always wipe from front to back after using the toilet. This may sound simple, but it keeps bacteria away from your urethra where they don't belong. Also, make sure to wash your genital area regularly, but use plain unscented soap. Fancy scented soaps and sprays can actually cause irritation, making things worse. Next, when you feel the urge to go, don't hold in your urine. Go to the bathroom as soon as possible. Think of it like this. Bacteria that enters your urethra is constantly trying to climb into your bladder. When you pee, you're defending yourself from this invasion by flushing out that bacteria. The more often you pee, the lower the chance of getting a UTI. That's also one of the reasons that you pee frequently once infected. Your body is trying to defend itself, but at that point, it's just too late. Here's another important tip. Try to pee before and after sex. This helps wash away bacteria that might sneak in during sexual activity. And whenever you're done swimming, working out, or sweating, change out of wet clothes quickly. Wear cotton underwear and avoid super tight clothes. Cotton lets your skin breathe and keeps things dry. Tight pants or synthetic underwear trap moisture, which bacteria love. While we're talking about moisture, remember that showers are better than long baths. Sitting in bath water can increase your risk of infection, so keep it brief if you love soaking. Now for some lifestyle tips. Make sure to drink lots of water. Staying hydrated helps dilute your urine and means your bladder empties more often, clearing out germs. Skip too much caffeine, alcohol, or overly sweet drinks since they might irritate your bladder. If you use pads or tampons, change them regularly. Now for some nutrition and medicine options to consider. Some women benefit from probiotics, those healthy bacteria found in yogurt and supplements. These can help your system stay balanced. For women who are postmenopausal, doctors may suggest vaginal estrogen cream to refresh tissues and lower the infection risk. I get asked a lot if drinking cranberry juice will help a UTI. Let's break that down. Cranberry happens to bind really well to E. coli, the most common cause of UTIs. Once the E. coli is hanging on the cranberry, it's much easier to flush it out when you pee. That won't help much when the infection is rooted, and it won't help prevent UTIs that are caused by other bacteria, but it can definitely help. The next question is what format? If you're healthy and active and don't mind the sugar load, drinking cranberry juice as a preventive measure will definitely help. For my diabetic patients or those concerned about their sugar load, I suggest cranberry extract pills. I've seen it work both ways. The last bit of advice is about azo, otherwise known as pyridium. It's designed to help stop the bladder spasms that are caused by bacteria irritating the bladder wall. Pyridium does not treat UTIs, it only masks the irritation. If your body doesn't clear the UTI on its own, you'll be unaware as the infection climbs to your kidneys, which will end up with a hospital visit. I don't encourage anyone to use azo until 24 hours after antibiotics are on board, because at that point they should be working and the pain should go down and you know it's safe to take the azo. So the main points to remember here are to hydrate regularly and pee often. It is your best defense. UTIs are common, but you don't have to just put up with them. By making these simple changes and sticking to healthy routines, you can lower your risk and keep your life on track. If you feel stuck or need help with frequent UTIs, you're welcome to get a virtual checkup with my practice at Bespoke Concierge MD. Thanks for watching. If you found this video helpful, like and subscribe for more health tips that really work. Drop any questions or personal experiences in the comments below. Let's support each other.